How to do a male kegel. On this slide, I will be teaching you how to do a male kegel. And yes, males do kegels differently from females. The muscle that closes the urethra is at the base of the scrotum and penis. This muscle is the urethral sphincter. And there's an internal and external urethral sphincter. Unfortunately, with prostate cancer surgery, the internal urethral sphincter is often damaged or has to be removed due to cancer. So now you have to rely on your external urethral sphincter. Now, this muscle is in front of the anus, so you have to make sure you're differentiating where you're contracting. So we want to close the urethra at the base of the scrotum and penis, and you're contracting in front of the anus and not contracting the anus and the butt cheeks. Now let's go to the next slide. There's a second part to doing the male kegel. The second part is nuts to guts. Here, I want you to imagine that you're completely naked and you're about to enter a really cold, freezing swimming pool. As you walk into the swimming pool and the water is getting closer and closer to your scrotum and balls pull back up into the body to get some warmth. So that's what we call nuts to guts. So the first part of the kegel is closing the urethra at the base of the scrotum and penis. So imagine you're closing a straw to stop the flow of urine at the base of the scrotum and penis. And then you perform the nuts to guts, where you imagine your scrotum is rising up towards your body for warmth. So you've learned how to do a male Kegel contraction. Now I'm going to teach you about the breath, because the pelvic floor and diaphragm move together, and the pelvic floor contracts more efficiently when we do it with the breath. So imagine you're inhaling very slowly. As you inhale, your lungs fill with air and your ribs open like an umbrella, front, back, and side, so that more air can get into your lungs. And then when you exhale, you slowly let the lungs deflate, letting the air out slowly with no muscle activation. So that is a slow, deep, relaxed diaphragmatic breath. The second part to breathing is the exhale. So as the air is deflating the lungs and the ribs are coming back to center and your belly is deflating like a balloon, this is where you want to contract your nuts to guts and closing the urethra. So we want to do the Kegel on an exhale. This raises the pelvic floor and it follows the diaphragm up to help get more air out of your lungs. Okay, now let's slowly inhale to prepare. You're going to activate the pelvic floor, Kegel, and squeeze the ball. Exhaling and Kegeling for 10 seconds. Exhaling and Kegeling, last 5, 4, 3, 2, and rest. Rest the pelvic floor, relax breathing, and when you're ready for the next one, slowly inhale to prepare. Exhale and Kegel for 10 seconds. And rest. One more to go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and rest. So we're going to do our Kegel with active movement. So slowly inhale to prepare. You're going to Kegel and slowly open your legs and bring the legs down and rest the pelvic floor. Let's do 2 more. And slowly down, rest the pelvic floor, Kegel, open, and slowly down. Now we're going to perform a squat lift with a Kegel. So Mr. Leahy's going to inhale to prepare, Kegel. He's going to stand up and lift, and slowly down, return to starting position, and let go of the pelvic floor. Inhale to prepare, Kegel, and exhale, simulating lifting a box, and then slowly putting the box down, holding the Kegel through the movement, and rest. Last one. And rest. Perfect.
Hi, Jack Leahy. I'm here to give a testimonial to Erica Gold and Harmony Pelvic. I had a fantastic experience here. I had a lot of leakage and went down to almost nothing. If you want to get dry after prostate cancer surgery, call Harmony Pelvic Physical Therapy at 772-342-4490.